Also, we have the distinguished speaker from Korea, Dr. ChoiHoSung. He is the global training instructor for UltraV, and he's going to share with us the UltraCo, the innovative biostimulating PDO powder. Please give a big applause to him.
Hello, good evening, everyone. Dr. Ho-Sung Choi from South Korea. Very honored to be here and very happy to be part of this great event. And fortunately, this is the last lecture today. Let's get back to the UltraCo. My topic is about forehead contouring, smooth and seamless forehead recontouring using UltraCo. Okay. Currently, I've been using various biostimulating fillers because they have very strong points compared to HA fillers. Among them, these are tunable biostimulating fillers. Tunable means it can dilute before use, depending on the purpose of treatment. And among them, the easiest and safest tunable biostimulating filler is, I believe, UltraCo. I agree that PDO particles don't last long. This short longevity is not necessarily a weak point. Rather, it could be a strong point in terms of safety, as Dr. Kwon already mentioned. And we have two types of products. And I think compared to HA fillers, why we should use UltraCo? Because unlike HA fillers that give only volume, UltraCo can give not only volume, but also skin quality improvement. This is the most attractive point, in my opinion. And let's talk about UltraCo 200. I reconstitute 3 to 5 ml of distilled water, and we only need 30 minutes. We don't need one or 2 days of incubation period. And I mix a little lidocaine, and I just inject with 22G cannula, my preference. Because I make entry point for the skin puncture using 21G needle, and I use 22G cannula. And the proper layer will be the subdermal layer, which is layer 2. And we need very careful and enough dissection before or during injection. Because the more you dissect, the more collagen will be produced. These are suitable areas to use UltraCo 200. Among them, I would like to talk about the forehead. I think you are already experts, so I will skip this anatomy. We should be careful of these arteries, 2 main arteries and 1 from superficial temporal artery, the frontal branch. And actually, when I inject HA filler, typically I use into layer 4, supraparietal layer or subgaleal layer, which is deep layer. However, when I use UltraCo, I also inject into the superficial layer because it has biostimulating effect. So I believe that this product should contact a lot with to the dermis. So that's why, but you should be very careful because there are plenty of vessels in layer 2. So when using 22G cannula and very carefully dissection, you won't need to worry about vessel damage. And these are my favorite entry point locations, these 3 areas. So this is my most favorite entry points in general. I had 2 entry points from the very close to the medial end of eyebrows, and 2 entry points far lateral eyebrows, almost 1/4 laterally. And I dissect very carefully, and I take my time when injecting UltraCold, regardless of the amount. And if the treated area is a very small or part of forehead, then you only need 2 entry points will be enough. And when injecting into the temple together, I sometimes make more entry points. So I'll show you a short video. First, I designed 2 frontal eminence, which is usually bulged areas. And normally this shape, like UFO, will be the treated area. And yeah, I should inform my patients about the necessity of temple augmentations. If not, I can do it separately. So when I make an entry point, I pinch the skin and I just penetrate the dermis. I don't need to go deep. And then I dissect into the forehead gently. And I don't inject only into the subcutaneous fat layer. I inject usually into multiple layers. And you know, when injecting HA filler into very superficial layer, sometimes filler migrations may develop. But UltraCold, you don't need to worry about the migrations or undulations, irregularities, because it's easily spread. But you should inject very evenly and very gently. And another entry point to cover the lateral part of the forehead. And this part, you should be more careful because there are more concentrated vessels in this area. And I'm playing a little bit faster. Actually, I'm not doing that fast. And if you inject very gently and evenly, you don't need to mold after injection. I only need to press with a 4x4 gauze, which has no elasticity, and it's quite useful. And when injecting temple, usually if the temple area is severely depressed, then I inject HA filler into the deep layer, and then I move to the superficial layer to inject UltraCold 200. The superficial layer is not layer 2, it's usually interfascial layer. So, between the superficial and deep temporal fascia. And then the volume and superficial rejuvenation can be achieved together at once. These days, many patients don't want a very pouty or volumized forehead. They usually want very naturally rejuvenation of the forehead. So I think the UltraCold 200 will be the choice for those patients. And after 3 months, the volume is still there. You can see the volume, and I think even more natural after injection than before. And the protocol is 2 to 3 sessions, but I rarely do 3 sessions. Usually 1 to 2 sessions are enough. But if you dilute more, if you inject less amount, then more sessions will be required. And to maintain the good results, I recommend my patients to proceed every 6 months or 6 to 12 months. Okay, personally, clinical strong points of UltraCol, especially UltraCol 200, is our PDO is very familiar to us, right? We are using a lot of PDO threads these days. And then it's quite convenient because we don't need to wait 1 day after full reconstitution. We can hurry for our patients. And it's quite safe. We don't need to worry about nodules formation and natural outcomes. The very obvious trend of these days, the obvious trend of medical aesthetics. And the last one is facial recontouring by trimming effect. This is my last point. So I'll explain this and I'll wrap up my lecture. Trimming effect. Trimming means make the skin surface even and very smooth. Just like when, you know, for landscaping work, they usually cut off the branches of tree and to make more smoother contour. It's just like that. To achieve trimming effect, we should understand two important mechanisms. The first one is stretching effect. See, if you pull the skin tissue in both directions, this bulged area will be compressed, and this pressed area or depressed area will be elevated. So finally, we will have smoother and even skin surface, just like, you know, spreading a crumpled carpet. And the second mechanism is this one, covering effect. Although the patient had already previously injected something, fat graft or other filler materials that last quite long, and the patients, they see that their foreheads look like not smooth, undulated. Then after injecting UltraCol 200, we can achieve smooth contouring by covering these irregularities. This is very important and very effective when I treat my patients, because, you know, in Korea, it's really hard to find very fresh patients who never did any treatment before. In Thailand too, right? Yeah. Okay, so many patients, they had already injected something in the forehead, and sometimes they don't remember, they cannot remember what kind of materials. And I see some undulations, and normally I refuse to treat those patients, but when using UltraCol 200, I can manage them. So after 3 months, a bit swelling because the distilled water is included, but after the water is gone, the very subtle but very natural and effective result after only 1 session. And she is quite old, and she had not only undulations but also skin wrinkles. So for those patients, most of them, they don't want too much volume on their foreheads, right? They only want to rejuvenate their skin on the surface, skin surface on the forehead. So I can insert threads, or I can inject intradermal, very soft HA filler, but it does not last long. And we cannot fix the overall contour. So when I use UltraCol 200, I can not only fix these wrinkles on the surface, but also I can recontour very nicely overall forehead. But even young patients, personally, I mix a little amount of soft HA filler, cross-linked HA filler, but it's my personal use, so just refer to it. And then I can create more volume. So, yeah. Of course, I can achieve good result, similar result by using HA filler, but it's easier. You know, HA filler, maybe because I'm not very skillful, I usually make touch-up at least 1 or twice, so it becomes very stressful. But when using ultra cold mixed with HA filler, then no need to make touch-up anymore. And she's the last photo, I think. She has a skin dent after several times of fat graft procedures. And I used to inject soft HA filler very focally, but it doesn't last long. Every 3 to 6 months, she comes to my clinic to inject a small volume of HA filler. But she was very tired to visit my clinic every 6 months. So I tried to inject UltraV 200, and it was about 6 months ago, and she never come back anymore so far. You see, this is the covering effect. So this is my conclusion. When you want to make both actions, such as skin quality improvement and then very optimized volumization, then just use UltraV 200. Thank you very much. And 2 months later, the 2 Korean, very famous Korean medical aesthetic societies, we are co-working to prepare a big event that will take place here in Bangkok, in Berkeley Hotel. And Professor Wang Shima is helping me a lot. And I hope I hope to see you all 2 months later there. And I think it will be very interesting. Thank you very much.
Thank you.